the government pays in America, we have price controls. They're already here for that sector. So the government, when the government says we're only paying $17 for this $45 bottle of pills, that means part of the reason that it's $45 is because the government only pays $17. And you know, we can argue about what, you know, whether or not some drug company executive should have a Lamborghini or whatever, but I mean, the innovation in drugs and medicine that goes on in America goes on because, and we pay a price for it. We watch the double-digit increases, but a lot of that is done here. And when you have other countries or portions of the market here that you know, economically speaking, are going to free ride on that, you know, the rest of us are going to pay more. So we either can dispense with the innovation, not have, you know, new pills, not have the latest open MRIs, not have those kind of things, and, you know, take a less go-go approach to medicine, or we can look at least how to try and fairly spread those burdens. And currently, the reason that you saw that reduction in your bill is because we have price controls in America.
Yes, ma'am.
Hi. First, I'd like to say thank you. Secondly, my name is Tricia Robichaud. I'm from Loughlin.
Welcome.
Thank you. As far as healthcare reform, the four probably biggest things that I keep hearing that I'm not interested in are proposals that create bigger government, move us in any way toward a single payer system, our taxpayer dollars going to pay for illegal alien care, and also my taxpayer dollars going to pay for abortion. Are there any proposals? You mentioned there are 6 approximately.
There are actually more than
that bandied around in DC.
There are more than that. There are several competing bills. I've got a matrix that includes some of them.
So my question is, are there any out there based on those just 4 major criteria for me that I can support it?
Well, your point on the abortion, just for everybody, electronic brains, my wife calls it, because there was action today that doesn't help us. Warren Hatch proposed a bill that was actually today that would have restricted abortions, saying that any plan that had an abortion right could only be paid for out of its pocket, could not be paid for with tax dollars, and that was shot down. This gets back to the joke we should start the panel to say that if you don't agree with anything he said, it's impossible, point across it. Because the Joe Wilson was correct, that while there wasn't a line that said you won't give benefits to aliens, there was no teeth in that. So, you can say anything you want, unless you put a penalty to it, it's still going to happen. So, what is being proposed right now, no, there's nothing that they can do.
Yes, sir.
Good afternoon. God bless America.
Thank you. Yeah.
I have a 2-part question. And the first part is healthcare is such a crisis, and it needs to get done 2 weeks in August. Why is it that most of the program won't be implemented until after 2013?
That's an excellent question. The cynical answer would be because of the election. I don't know why we can't take time to study these proposals. They're not even until after the 2010 election. You're absolutely right. Second part of your question.
Second part of the question. I think healthcare is going to be the easy part for you if you're elected. As a parent of 4 boys that served in the Marine Corps, what are you doing? What are you willing to do to support them that's not being done for them right now? Those guys in Afghanistan are being left hanging out on the land.
First of all, I'm going to mention a small thing to do with defense, and then a much larger thing. Again, we were going to try and focus on healthcare, but I think this is important, and I want to definitely answer your question. We're in Afghanistan. We're there. We have to win that. We're not in a position where we can withdraw those forces out of Afghanistan and anything good will come of it. If we unilaterally withdraw from Afghanistan, what happens is that the Taliban celebrates a victory of having defeated the Soviet Army and the U.S. Army, and we now have the world's greatest staging area for terrorism. We have no options now at this point other than to do what's right, put the forces in there needed that we need to be able to win that conflict. You can argue whether or not we should be there to begin with. We're there. And you can't be a little bit pregnant. We saw what happened when the surge kicked in, which was opposed, by the way. The surge was opposed by virtually everyone who's in power right now. We saw what happened when we let the generals have the forces they needed to be able to make the tactical decisions on the ground to turn that conflict. And we've seen great change in Iraq because of it. And what we need to do is we need to decide that we're going to win this conflict. We need to commit the forces that are necessary to do it, get the job done, and then get the hell out. Yes, sir.
My name is Jim Gallipo from Middletown, Rhode Island, and I'm happy to see you run against Patrick Kennedy. Patrick Kennedy, we want you out. You're not responsive to, I think, the mainstream of I don't deny that the cost of health care is high. It's very difficult for a lot of people, especially senior citizens. But I believe we have the best health care system in the world. I think statistics show it. I don't buy the premise it needs to be fixed, aside from the cost factor. And a lot of talk has been, a lot of valid points have been brought up. We need to, President Obama said it's going to bring if this bill is passed, I don't know, $300 billion from Medicare fraud. Why are we waiting for the bill to be passed? So I don't believe it needs to be fixed, and especially not by the government. I mean, what have they done? They can't run Medicare properly. They can't run Social Security properly. So we need it fixed.
So they can't run the post office.
That's right. So government health care, run health care doesn't work anywhere in the world. There's no valid evidence of that anywhere. And I just want to talk about very briefly this idea of a compromise bill and putting a bill together here. Since I don't believe it needs to be fixed, I don't think there needs to be a bill. And I'm going to talk about that because a couple of years ago, I saw a video of the president a couple of years ago, and he was talking about how his goal was government-only run health care. And then it might take 10 to 15 years to get there. So this bill, these bills that the Democrats in Congress are putting forth are, I don't believe he thinks he's going to get the, what is it? The public option. I don't think he believes he's going to get it. And I think they're going to try it. And I think the Republicans in Congress now are getting sucked in and they're going to compromise and they're going to get what they want. If you look at history, the progressives have been trying to get government-run health care here for almost 100 years. It's been done all around the world by other progressives, socialists, communists. And so I don't want to see any bill because it compromises and move in that direction. And I think tort reform, why don't the elected officials do what they're paid to do? Fix the government and get the government off our back. Go after tort reform right away. Deport illegal aliens. Bring the cost out of Medicare and drive the cost down. That's what needs to be fixed. We don't need bill upon bill and added cost and more government spending. I was in Washington at the beginning of this month at that march, and I was just awestruck by all those buildings that are filled with technocrats that we're paying for. And it's not that they're not new. Their fathers and their fathers' fathers were there too spending our money. And I'm sick of it.
Yeah.